How are biopsy specimens used in biopsy procedures? Imagine trying to solve a mystery in the body. Biopsy specimens are like clues that help doctors figure out what is happening inside. During a biopsy, a small piece of tissue or cells is taken from a suspicious area. This tiny sample is very important because it shows what kind of cells are there. It could be normal, abnormal, or cancerous. There are different ways to get these samples. Sometimes, a doctor uses a thin needle to draw out tissue or fluid. This is called a needle biopsy. It is quick and usually done with guidance from ultrasound, CT scans, or MRI images to make sure the sample is from the right spot. Other times, a small part of a lump is cut out, which is called an incisional biopsy. If the entire lump is removed, it is called an excisional biopsy. These methods depend on the size and location of the abnormal area. Once the sample is collected, it is sent to a special lab called a pathology laboratory. There, a doctor called a pathologist looks at the tissue under a microscope. They examine the cells closely to see if they are cancerous or not. The pathologist checks the size, shape, and organization of the cells. This helps confirm if the abnormal area is cancer or something else. The biopsy specimen also helps determine how aggressive the cancer might be. This is called grading. It shows how quickly the cancer cells are growing. The sample can also help find out how far the cancer has spread inside the body, which is called staging. Sometimes, additional tests are done on the sample to look for specific gene or protein changes. These tests help doctors choose the best treatment options. For families and caregivers, understanding how biopsy specimens are used is important because the results guide the next steps. The biopsy results help decide if surgery, chemotherapy, radiation, or targeted therapies are needed. Sometimes, more tests are needed after the initial biopsy to get a clearer picture of the cancer. It is good to know that doctors take care to make the biopsy process safe. They aim to reduce risks like infection or bleeding. The procedure is designed to prevent cancer cells from spreading. Side effects are usually manageable and depend on the type and location of the biopsy. In the end, biopsy specimens are the key to confirming if there is cancer and understanding its characteristics. This information helps doctors plan the best treatment and helps families understand what to expect. The process is a vital step in the journey toward diagnosis and care.